Hi, I'm Stephanie, a PT, and together with Nicole and OT, we are a PT-OT duo that make up the Note Ninjas. We teach PTs, OTs, and assistants treatment ideas and documentation tips. So today, we want to show you just a variation of doing marching, adding a little bit of extra coordination, range of motion to the exercise. So, in sitting, we have our patients. A lot of times, we'll do marching. It's a great activity. It really helps with those hip flexor strength, get your legs up, helps with walking, ADLs, functional activities. But they're just marching, and sometimes it gets a little old, and they start doing this. So today we're using a 2 pound ball. You can use unweighted ball, a ball with weight, whatever you want to do. And we'll have them march, and we'll have them bring the ball underneath their legs and thread it side to side. So this ball helps give them an external cue that they have to lift up their leg higher to get the ball through. It also helps with coordination. And using a little bit of a weighted ball also helps engage my core. I really have to focus on keeping my core tight to not really lean backwards, which is the whole point of a marching as well. You can do this in sitting, you can do this in standing, and then you just want to document. How is your patient presenting? How are you progressing? Maybe you're starting your patient with just marching. And then in a couple of visits, you say, progress your patient to marching, threading a 2 pound ball. Cue patient to facilitate core to decrease posterior slouch. That is showing your skill, is showing progression, and it's showing how therapy is really helping your patient, especially when you relate it to a functional activity that they can do better. Remember, it's not always about doing these crazy activities and all this extra equipment. It's just about modifying and enhancing what we are doing to get our patients to their goals. So make sure to follow us at the Note Ninjas for more activity ideas and documentation tips.